Good morning, good evening, good afternoon. Dr. Pablo from Atlantis Salute Spa. What a day! Another day in paradise. I hope you're doing well. I've been on my 200 acres today. I'm tired. I started at 5 o'clock this morning and got picked up at 6 on the block. By the time we organized some products and that, we were 8 o'clock and shoveling cement by 9 o'clock, and a big day, a big day. And we had some beautiful friends come and join us in the afternoon and had lunch. They're up on the Atlantis housing community website if you're following that. If you're not following that, follow that if you want. If not, uh, you're more interested in GcMAF, fighting cancer, autism. Amazing product, amazing results with autism. We have a program, 2 weeks, week off, 2 weeks, but I'll get into that into the presentation. So sit back, have your paper ready. I got a hot chocolate because we not long got in, and I'm exhausted, and it's a pleasure to be with you tonight and just to talk openly about the products. This series of videos, this is number 2, I think, of 5 days of videos, and we're talking just the one product each day. So I'll need to have a drink. I got cement and that on my legs, so thank goodness you can't see my legs, yes? Okay. Make sure the screen's good before we start. I don't know, I can't get rid of that hailing. Maybe somebody out there who's a video expert can say, hey, if you do this little adjustment, that will fix the problem. Okay, so thank you for joining me tonight. I love the comments. The video yesterday had, I think when I left this morning, 300 to 400. It's on 5 different sites. Thank you for sharing it to those people on the 5 different sites and the administrators of the sites to share it. I really appreciate that. I've been in this industry for 20 years, and every year we find something a little bit new. So it's evolving. My students are my teachers, and in the case recently, we had another product added. But GcMAF has been with us for a long time. A long time. How many years have I been doing GcMAF? What are we in, 20? Maybe 2.5 years. I would guess at 2.5 years. And in the beginning, we investigated. I spent 2 months. I spoke to so many professors and they were so generous with their time. And they all had certain things that they were doing, but certain things that others were doing that they weren't doing. And I found it quite interesting. And so I'm doing something different than all of them because I understand and I see things differently than other people. So in the beginning, we were buying little vials from Japan. And Japan, if you don't know, is not China. China is, I love people all around the world. So this is not picking on anyone's culture. I love the Chinese people. I love the Japanese people. Japanese may not like Chinese so much because they're neighbors, but they do a lot of business together. So anyway, there's so much racism going on in the news. I have that on my mind, so I'm just being careful with my words. But anyway, the Japan product is a little vial. It has 2,500 nanograms. So 2,500 nanograms. One dose, depending on what you're using it for, one dose is about half of that. So those vials are between $500 and $600 depending on the exchange rate. So let's say the cheapest of that, it's $250 an injection. And you have the risk of being lost in customs in delivery. Our product is in most countries of the world already. We have outlets in most countries around the world. So we can deliver this to you very quickly. Our product is more than half of that price. It comes different. It comes in a bigger container. Why? Because you need to use this for 1 month plus to see any result. It's no good buying a little vial and you're using that a day. So it's very hard to get delivered to you 60 little tiny vials. It's not going to get in through delivery systems. So by sending one vial with the equivalent of 60 in it, it's better. It's easy. We don't have problems. We don't have complications. So that is the main reason behind why we have one vial for their 60 vials. So our product is made from colostrum. We had success with their product. We had people only doing that product and vitamin B17, which we spoke about in video 1. And vitamin B17 with bone cancer, it takes, I haven't seen vitamin B17 get a result with bone cancer. I've seen somebody with bone cancer that was progressing very fast and that stopped growing, but they didn't have any remission, and eventually they didn't make it. I'm thinking of a particular man. It was growing 1 inch a month, and when he started with the nutrition and the vitamin B17, it stopped growing. It didn't progress anymore. So GcMAF, you all understand that, or you all would have heard that the children that are breastfed seem to have a stronger immune system. One of the reasons they now know is this protein that is found in the breast milk activates what is called microphage. It actually doesn't. It makes microphage in the body, so the child may not even have any microphage. So it's a very, very important fact. What are the macrophages? What do they do? If you would think of your body as having a war when it's being attacked by something, be it parasites, be it viruses, be it poisons, whatever it's being attacked by, the first line of defense, just like in a war, you send the foot soldiers, perhaps. So these are the foot soldiers, and they find a problem and they absorb it. They eat it, dissolve it, and absorb it as food in your body. What's not absorbed is carried out of the body. So when you get that runny nose, that is dead microphage coming out of your system. When you get a discharge, it's microphage been attacking something and coming out. Similar to the white blood cells when you get pus on a pimple, that is the white cells have been eating and destroying and accumulating a problem, a splinter or something, and it comes out through your skin that way or gets reabsorbed by the microphage. So that's their job, to clean your body. They have a proven role to fix a lot of things. This product has more health benefits with every single health issue. The list is too long to go through today. You'll have to go to my website and read the list. It's so long. But let's talk about a couple of things that are on the top of the list. Autism, amazing results. This is an important, integral part of our process to help children improve that are suffering from autism. Cancer, my first experience was with the Japanese product, and it was a spine cancer. And you see it in a book I published a year and a half ago, where we actually put the results that he had 4 places where he had bone cancer, and the penetration was so bad that they considered that he would be in a wheelchair within months. When he went for his follow-up scan after starting our process, the cancer was gone in those vertebrae, completely gone. Now, he also had it in the rib. We only injected in that area. Why? Because you only have so many foot soldiers inside you. And if our first approach is to inject everywhere, then tackle what is going to cause the biggest issue if it doesn't disappear. We need to get rid of that first. Because the GcMAF, what I've learned, is the microphage move to the area you inject. Doesn't make sense. But why? Because if you inject in the area, your body sends a signal that there's a problem there, and they send it. So you need to inject around the cancer site, and the microphage move in, and the microphage are slow because cancer gives off a chemical called nagalase. And nagalase puts all of your immune system to sleep, including your microphage. First line of defense to call if you have an infection. That's why people with cancer often can die from a problem not related to the cancer. It can be pneumonia, can be any other infection because their immune system is compromised. So once you reactivate the macrophage, all of those issues and possible early death from non-related cancer issues should disappear. Your macrophages are reactivated, they're awake. You can't have 50,000, you can't inject this 10 times more than you need. That won't hurt you, you have no side effect, but your body will only make so much. Like you'll only make so much blood, you'll only have so many white blood cells. It's what the body needs. It's a range between this, and you can't have 10 times more. So injecting more there's no benefit. But waking up and overcoming all of that nagalase that the cancer is giving off. Nagalase is a chemical that viruses and cancer give off to put your immune systems asleep. That is why your body doesn't recognize the cancer as a problem, because the first line of defense has been put to sleep. It's so obvious. And the people who put this together is amazing. And it's now available to you, the first line of defense. This is one therapy you can't do if you're doing chemotherapy, because the chemotherapy is killing your immune system, and this is waking it up, killing it. It may even prevent your chemotherapy from getting rid of the 50 to 80% that it should, if it's got a chance of working. Get rid of that much. And then this has to work for 3 months before you're going to see it, because it's trying to overcome all of those poisons and cleaning that out of your system. So remember, this is really, really, I can't stress enough how important this is. It's important to understand that there is only so many foot soldiers, macrophage in your body. And if you stub your toe, they're down there fixing that. If you fall over and knock your knee, they're fixing that. They're going to where the body tells them to go. And they don't see the cancer as an issue until you make it an issue. So you've heard of people injecting viruses into the body. The cancer is an issue, the immune system moves in. But they're slow. But if you put macrophage in, they're turned on, they're like, oh, ready for action. And they have a chance of saving your life. And so this presentation is about GcMAF. And the MAF stands for microphage activating factor, made from colostrum, mother's milk, not made from blood. So the Japan product was made from blood, human blood. They used to pay people. I asked them, why was it $500 to $600 a little 2.5 ml vial? And they said, we have to pay people for the blood. We only get a small amount out of the blood, and then we grow it, and it's a process, and so on. It's still a really expensive product. But like I said to people, you know, if you're driving your car and your gearbox blows up, in a week's time you have a new gearbox. You're not walking anymore. Yes, you don't mind spending money. If you dent the car, you need to spend $2,000 or $3,000 on a new bumper. You do it. If somebody breaks your windscreen, you have it. If you don't have insurance, you get it fixed. If you do, you're spending, you know, in the life of the car, you're spending $5,000 to $10,000 on insurance. This product, you spend $2,000, $3,000. 6 months, you'll spend maybe $5,000. But it's your body, it's your life, and it's definitely worth the investment. This product is no gimmick. It's amazing, and the results I've seen with all different things is absolutely priceless. Personal experience, my wife, colon cancer gone, and the spine cancer was the very first. Like, I was falling off my chair that within 2 months, those four vertebrae, backed up with a doctor's report, completely gone. Amazing. Amazing. So that's a little bit about it. And so let me have a little sip of my hot chocolate. 8 o'clock I go to bed, so I'm tired. So I'll put on my glasses, and I'll start the presentation. You all ready? So please write a comment. The comments stay on top, I realized the other day. So feel free to leave a comment. And if you're not watching this live, you're watching the recording online, please leave a comment, because I will answer every comment that's written. I always think that it's important. You tell me what you think, and I have no problem answering questions on the subject and telling you my experience with the products. So now I'm changing to the computer screen. If this works, look at that. Okie dokie. I think you can see me somewhere on the screen. I don't know. I hope you can. Maybe this is me here. So I'll put myself up here. A little dots. How's that? Comments there. And I don't need that one. I hope this doesn't disconnect us. I don't need that one. Okie dokie. So Atlantis Salute Spa has been is our business name here, and has been our business for I've been doing this for 20 years, and in this new country, 5, 6, 7 years now. I came to this country, which is South America. The reason being, it's a beautiful place. The temperature's nice today and better tomorrow. We have a 6 weeks of rainy year, a lot of sunshine, sea breeze, no pollution, beautiful people, and I love it. And it's central. It's it's the center part of the planet. It's close to the USA, a 3 or 4 hour flight from Florida. So the bottom of the USA, we're 4 to 5 hours flight. So it's pretty easy. From Australia, it's a longer flight, and we also have a lot of people coming here from England. And I'm not sure of the distance, but often there's a stopover in Mexico or Colombia before here. To come here from the US, there's a flight to one of the Ecuadorian airports, and then there's another short flight to us. So it's pretty easy process. Now that things are starting to settle around the world, next month, so the 1st of next month, July, the flights are all open, and it's an easy process. You have to have a blood test before you leave to check that you don't have any problems, which is a good idea to keep you safe and to know that you're coming to a place that's safe. So, okay, so the new website, which will be finished by the end of the month, or by the time you're looking at this video, because it'll be up for years. That is our website, and Atlantis Health Retreat, and that has all the details of the services we offer. We have 2 business models. We have one spa, which is on the beach of Salinas, and on 200 acres we're building a beautiful health retreat. So the doctors that I'm talking to, helping in around the world, it's close to your time to retire. I recommend you retire. Come and work here a couple of days a week. We want to have 10 medical doctors, and we also want to have about 10 naturopathic teachers. We're going to open a school of alternative medicine here, so I'm excited about that. And so if you're planning your retirement, 12 months from now, we need you here, and you will have nice, healthy food, beautiful environment, be able to sit back and relax, and only work a couple of days a week, because we want you healthy, and we want you to help as a team, help out people. So let me move that. There we go. So GcMAF, our product is, as it says there, just here, that's not good that keeps moving. I'll take my hand off it. Okay, so this product is definitely in the top 5 therapies that I am most excited about, and I've never seen something that has absolutely no side effect, no issue, no temperature, no coldness, no shaking, no nothing, no issue whatsoever, except waking up your immune system, because it's some product that you meant to be having. And so what puts your nagalase, what is putting nagalase out? What is putting that into the body? So there's a lot of studies, especially in the USA, that say there's nagalase that viruses give off, cancer gives off to suppress your immune system. That there's a lot of studies that say that nagalase is being put into the immune system when you have your measles injection, all of those injections. I don't know how many they're up to now, but there's more than 10 products injected in the first 10 years of a child's life. So there's chemicals being put in there that put your own immune system to sleep, possibly to increase the benefit that the product that they're putting in that. But really, I'm anti-immunization. Live viruses, yes. So they get a weak version, a very weak strain of a virus, and inject that into you, no problem. Your body will handle it. Put your own immune system and give you parts of the virus along with human tissue, along with parts of babies. And if you think I'm wrong, go to my website. There's a professor being questioned in a courtroom, and it's quite clearly what he's stating. That is one of the reasons that they're using the birth clinics, and I don't want to go into that. It's like really bad and upsets me to even think of that. So I'm anti injections on anything that is not going to promote strengthening your immune system and making you stronger. And this is certainly a product that activates the microphage. You can see there in the little image on the left of the screen where it says activating immunity. That's what a microphage looks like. And you can actually watch this in a live blood analysis. You can see people come into our clinic with cancer. There's no microphage. You can't see any in the little tiny pinprick sample of their blood. There's no microphage. We give GcMAF, and within days you can see microphage slowly moving around. By the end of the week, they're moving very fast, and there's a lot of them. This product mixes with vitamin D, so it's very important. Go move this so I can see what I'm doing here. So, like, it doesn't matter what therapy you're doing. If you're being anti-tumoral, you need zinc, you need enzymes, you need vitamin C, you need calcium K2 and vitamin D3. Now, if you have too much vitamin D, and what we do in the beginning of this protocol is we give you a lot more than what you would normally have, and then we reduce it. Now, if you're not having calcium K2, you can get bone buildup in places, which is not a good thing. But if you have calcium K2, you don't have that issue. So there's a formula we make sure you do and do it safely. And it's really vitamin D, even if you don't have GcMAF, if you have cancer, if you don't, as a preventative, vitamin D3 is something that you should be taking a small amount on a continuous basis. On my fifth video, we're going to be going through some products that you should be taking. So if you don't have money to do an intensive program to fix your health issue, we will tell you where to buy the supplies to do it economical. But GcMAF is so easy. And what you do is you take a syringe, a diabetic syringe, you half fill it, so it's 1/2 ml, and you inject it around the area under your skin. So if you have it in the throat, you can pinch your skin. You probably can't see me, but let me put my video back on. So you can see me clearly. Hello. Okay. So you inject, if you're injecting, you basically pinch the skin and you inject into that area. You don't feel it. It's like it's a diabetic needle. It's so tiny, and not usually there's no issue of any blood coming out or anything. So you just pinch the skin, inject. If you got it in the breast, around, don't go into the. So we don't go into the tumor with this product unless we don't see any changes in the first 21 days or 2 weeks, week off 2 weeks. In the end of the second 2 weeks, if there's no change, we may inject into the tumor. It may need a bit of a shock. People have no other choice. They're the last leg, and you need to try something. So but I can't remember when I've gone into a tumor because around the tumor is sufficient. Amazing product. So let me tell you a few things popping into my head. Sometime in your life, you or your children or a friend has sprained an ankle. Days after, usually the third day, you see all that yellow microphage that's moved in to eat all the tissue that is not needed, that the body's been repairing. There's little mechanics there throwing parts out. We don't need that. We'll put a new part in here and so on. They're just throwing it out, and the microphage is coming along like a little vacuum cleaner and cleaning up everything that doesn't belong floating around your body. We're like got a built our body's like a computer, and it has all these soldiers doing different things. And so, the black eye goes yellow after. I've never had a black eye, probably because I'm 6'10", 2 meters 100. They can't reach me, but amazing. You know, your little computer system is working, and there's processes that are putting it to sleep. And now we know that. We know a process that can turn it back on, go back to mother's milk. So this protein, it's a small amount in a lot of colostrum, and they ferment it, make a yogurt, and they do a process. So when we buy the top layer, so the most activating factor is the first time they do it, and then the next lot they get off is a little bit slower. They all work, but they work at different paces. So we pay for the very highest level. I don't want second-rated product here. So we pay for the highest factor is available, and we've seen the results with it. So we don't question it, but it's okay for you to question. It's a good idea to always ask a lot of questions. I'm doing this full time, so for me it's very, very important that it's the best and that you get a benefit from it. That's what we all want. Is it the best cancer therapy on the planet? It's the best one you can do at home, in my opinion. It's definitely the best one you can do at home. You combine this with vitamin B17 and a few other products, it's the best you can do at home. If you have a lot of cancer, like I said, your body can only make so many macrophages, so it'll start eating. Hopefully, the cancer growth is not faster than the maximum quantity your body will make and get in and eat. That's important. So, but when you combine this with other products that boost the rest of your immune system, so you can have good macrophages, but your immune system is very, very slow because you're all worn out because you've done this or done that, and it's taking everything away from you. So we give you a whole lot of nutrition that makes you strong and makes your body working internally and externally, feeling better, feeling stronger, reducing pain, so that the body can focus on the one problem. And the one problem may be in a few locations, but you need your body running on all cylinders. So we have an array of, this is not even a fraction of what you get in your box. And I think on the 4th day, we're going to talk about the cancer attack pack, which is it's not only for cancer. We make one for autism. We make one for different things. And we deliver that combination of products to your house. We used to have complete boxes made up in different countries, but at the moment, they'll be shipped directly to your house from the different suppliers. So instead of being overnight delivery, which is normal, you're looking at 7 to 14 days to get everything. But we can still supply you everything around the world, so don't be concerned. We use the quickest freight possible. So somebody's messaging me. They can wait until after. Okay, so the cancer attack pack one will be the last day, and the day after that, I'm going to go through all the different products available. All right, so it's a diabetic needle. You have arthritis, you inject in that area. You have a child with autism, you take it orally. Very, very simple. If it's not a problem to give a diabetic needle, try to give one in the muscle in the bottom. And if you're playing a game and you pinch the skin and you do it like quickly, they don't even know you've done it. And the results are like different. You get into trouble for making claims, so I have to be very, very cautious. I can just say, man, I'm really, really, really excited what I've seen with this product with children with autism. And now, I spoke a little about it yesterday, but I used to not say for adults, but I was wrong in that. The results are the same for elderly people as well as young children. I made an assumption that elderly people, that some of the behaviors have become a habit, but it's not. It's pressure in the brain. And this product combined with something else we do here, you can only do it here. It's not available in the home program. It is an injection. When you combine the two products together, and then you add in hyperbaric medicine, fun things that we do, change the diet, but change it in a fun way. It's pretty special. Listen, I get touched when somebody who's sent home to die becomes cancer free. It's uplifting. It's like a spirit is inside me, and it just I can't explain it. And so when you see a child with autism change little, or a lot or complete, it has the same uplifting feeling. It's just priceless. So I love the product because it's given me the gift to help people with those type of things. And so you can do that at home. You don't need to come here. But if it's not enough, we have another process. It's 2 weeks, week off 2 weeks. On the first day of the second 2 weeks, we do a little tiny spinal injection just in the bottom of the neck. And that, together with everything else that you do while you're here, can be a bridge to increase whatever you got in the results at home. So that's something for you to consider. That is only a 5-week program. So everyone understand the needle? Very easy, diabetic needle. So let's talk about the different cancers. Okay, so pancreatic cancer, we're going to inject underneath the rib cage. Breast cancer, I inject around the problem and at the base of a little tiny bit I share around the base of the breast. Why? Firstly, it's so quick and the movements are so quick that the patient doesn't feel anything. More importantly, you know that you have a lump there. It's possible that you have some other lumps. You don't know if there's still little tiny micro-sized ones there. So I want the microphage to encapsulate and move into the breast and start fixing everything. And somebody says, I only have it in the left breast. Well, I inject the right breast around the sides because I don't want you coming back. And if you have it in one, it may be some micro cells there, and we want it all gone. You don't want to have this problem. I always inject down the spine. Not a lot. Only the first week I'm giving 4, 5, 6 times, like it's $100 in the injection, but I will do $1,000 of injections the first day or the first week, more than that, because I like to go to everywhere I know the cancer is thinking of moving to. So I like to inject the spine, and if people don't mind it, so you have 10 to 20% find the spinal, it's not in the spine, it's each side. But some people is extra sensitive, so if it's painful, I don't do it because they didn't come here for that. But if people tolerate it, it's really good to get to make all of the areas where there's a potential for the cancer to move to stronger. So we work on the liver, we work on the spine, we do it orally. If there's a risk, if you've had lung problem or you've been a smoker in the past, we'll even do some nebulizing. So that's a mask you breathe in. There's a machine that vibrates so strong and the liquid carries the microphage, and you breathe it in as like a steam, but it's not hot. A steam that just goes into your lungs. So there's a whole lot of different ways of getting this product in. And I can't think, go to the website, I can't think of anything that this doesn't benefit. Like, it's priceless. I give it to everyone that comes through different IVs. They will get a little bit of microphage in an IV when they come here. So they may just come here for vitamin C drip. It's $100 or something. I'll give them a little bit of this just to boost their immune system. A lot of people over 50s, over 60s don't want to get sick. So they come to our clinic for that reason, to boost their immune system and stay healthy. We have a program where you do a 2-hour assessment, and in that, hopefully we don't find anything, but if we find something you didn't know about, we then can help you with a process to keep that away so you don't have that problem anymore. Hopefully. You can do an IV and not notice any difference. It doesn't mean it's like changing your oil on your car. You change your oil, you don't notice any difference, but your car's better as a result of doing it. That's what IV vitamin C will do. If you don't have any health issues, it's like a tune-up for your body. It should help with circulation, carry heavy metals out, decrease your chance of having Alzheimer's and other problems because it carries heavy metals out. Now, when we were younger, in my day, the cavemen days, that's many years ago, they used to have lead in petrol. And I think in the 1990s, unleaded petrol came out. So that's 30 plus years of my life I was breathing in lead, and so were other people who were born before the 90s breathing in lead. The lead was put in as a lubricant to make the motors last longer. In theory, I don't know. We don't have unleaded now, and it doesn't seem to be a problem. But that was why they put it in. And so lead affects short-term memory. What's your name again? What am I doing? Yes. that problem that you have, I have, forgetting names, is because of the lead that we were unknowingly breathing in just because we had a road in front of our house. And I lived on a busy street for half of those years, so I probably breathed in more than the average person. If you live near a highway, you were breathing that in. So GcMAF, microphage activating factor, is a priceless product. I think everyone should have it in their bunker. if you have a bunker for that day when the, what do they call it, the shit hits the fan, you're storing food, you should be storing nutritional products, maybe some antibiotics, and microphage. So you can freeze this product. It can stay frozen for years. So that's what some people do. They buy a product, use it, fix the issue, and put the rest in the freezer. You can take it out anytime. It's a protein similar to, like the powdered milk you make a protein shake with. It lasts for a long time, and you can freeze it and thaw it out as you need it. So it's in sterile water, so it shouldn't ever grow any bacteria or have any issues with it. So they've tested it over 1 year, 4 months in 30 degrees hot temperature, in hot, humid areas. There's been zero change of the amount of microphage it activates. Zero change in 3 to 4 months. And they've frozen it for a year, no change. So it's a product that you can freeze without any issue. It's used by deities a year from when we deliver it to you. Yeah, you're going to use it quicker than that anyway. So to get rid of a serious health issue, you're going to use 1 bottle, but you should. And the offer ends on Friday, tomorrow. So this weekend, the special offer, I think I have to check the video, so I think it ends this week. So we're giving 2 in our cancer attack pack, which we're talking about on tomorrow or the next day. You get 2 of them and double the quantity of injectable vitamin B17, an amazing deal. So that's like a $4,000 to $5,000 saving in that. So we have a standing order of $100,000 of this product, which we have $10,000 to $20,000 deliveries at a time. So we have a standing order. We've signed a contract because they have to make it. They have to be what I need in December. They're making now. You need to be pre-ordering a long time before. So we have good product and we turn it over and yeah, all's good. Okay, I don't think my presentation had much more. Any questions? No questions, no comments yet. Yesterday there were a lot, maybe nobody. I didn't promote this one because I was out today, so maybe some people don't know about it. So let me go back. So we covered that. Let me close that, saying nobody's chatting on that. So within 24 hours, this product will activate 50 different things in your body. It's like priceless. It's like your every organ in the body will have an effect from this product being put in your body in a good way, improving from your eyesight to your heart, your lungs, your kidneys, your ovaries, your sexual parts, your breasts, your joints, immune system, overactive immune system acting up and causing arthritis. It's amazing. It's amazing. Those that know my story, I was in a wheelchair for a long time, and I managed to get down to 50% of the medication as a result of an allergic reaction to a CT scan that caused me to be 6 weeks in emergency and almost died twice. And this product managed to get me off all of that medication that I couldn't. I managed to reduce a lot with nutrition, but I couldn't get off it. And this product made a big change in my life. Gave me energy, gave me strength, and yes, so I love it, and I love the fact again there's no side effects with it. So so go to my website. It's got, I think there's 101 different benefits for taking this product. Don't forget the zinc, the enzyme, vitamin C, and I'll be talking about the products that we recommend and sell. You probably can't see that, the light is not good, but I'll be talking about that on video 5. You have to tune in. I'm doing them all different times, probably annoy you, but if you go on Sunday to the playlist on our YouTube channel, and the whole 5 will be uploaded into one folder. So go to our Atlantis-Salute is our YouTube channel, and on that you'll find a playlist, and the playlist will be 2020 top 5 videos, and these short videos explaining these therapies. There's 5 of them. So today you can see there we're doing the GcMAF. Tomorrow, the most exciting product, high pH therapy. That is only for people that are looking for a solution that are fighting cancer, and that is an exclusively available here. So if you have a fast-growing cancer that's located ribcage and above, that you can't miss that. You need to be watching that. It's the most powerful product in the planet. The GcMAF we're covering today, and so that's on the 5th. On the 6th, we're going to be talking about how to bring all of these products together, how to do all of them in a safe way. And then on the 7th, we're going to be talking and showing you products, what is in the cancer attack bag. Now, I don't show everything, okay? I don't show everything because I'm not allowed to associate one product with cancer and so on. The products I'm showing are not being shown as a cancer cure. They're a formula to bring about wellness in your body, okay? So make that clear. I don't want to get companies into trouble. Nothing that I'm recommending in that video. These products are this is just a calcium K2. It's just a brand that I think is a good calcium for you to take to make your bones stronger. And so they're all part of getting the foundation right. If we talk about a car, you don't have good spark plugs and your tires are bad, you're not going to make a long journey. So this is about tuning up your body, making it functioning on all cylinders, not so they can cure you, so that your body can cure itself. So and I'm saying cure. People become cancer-free. What is that? That is cured. Cancer, you can't find it anymore. As far as I'm concerned, you're cured. So these products make you a finely tuned machine, and as a result, and not in all cases, nobody should ever expect that, but these are the best, the most amazing products you can use to fight your cancer. So the Atlantis Health Retreat website is being updated. June the 1st, people can arrive here. We're open that's a couple of days ago. We're open to start consulting now. And from July the 1st, people can start flying in. Once we've had confirmed bookings, there will be a 2-week, 1 week off, 2-week cycle. The week off is the week new people need to arrive. We're a boutique center. We don't have 10 to 20 people here. We only have 4 at the moment. In the new facility, there's going to be 100 beds and 10 doctors. So it'll be much bigger and better. But you're getting very, very unique service. You're getting the man who founded the company looking after you, along with 2 medical doctors and a fantastic team of nurses. So also on the website, I've added this time that we've had off, which I haven't had a day off, I can assure you. But I've spent a lot of time writing a few pages to give you a little introduction. It's not a lot of medical stuff because we get into trouble for writing too much. So it's just a little bit of information on the website. Now, last time I checked, you had to click on the home and then you could go to the different, like cancer, breast, so on. You can go to the pages, but all the rest of the links aren't working. Click on the home button and then go to another page each time. I don't know if today they managed to get that done because I wasn't talking to them. But the website's got a lot of information, and I've put all of those different pages on there to help you understand the services we offer and how every cancer is not the same. Every cancer is definitely not the same. And what I mean by that, cancer's a healing crisis. That part of it's the same, but look at that on top of there. Look at that. So I'm changing the word on that aged care facility because I'm in the category now, so it's mature retirement location, something like that. Sound good? Okay, so maybe you can write some suggestions in the bottom what you think we should call the new facility. So Atlantis Housing Retreat is the name, and this time next year we will have the elderly center is going to have. We're still trying to toss up on how many people are interested in it, but we're expecting to have a minimum of 20 apartments, beautiful nature, right next door to the health retreat, beautiful running water, just like you see here. We're going to have a little area where people can put their feet in, and it's no chemical, it's all natural. It's a chemical-free environment, so I'm excited about that. Those that know my story, 20 years ago I had a dream, and this is the dream, and it's now happening, and it's happening with a lot of blood, sweat, and tears, and a lot of determination. And the same level of determination is what we're looking for in the medical staff that we employ, that will fight so hard to save your life, that will put in every ounce of energy to make a difference. Not sit there and wait for something to happen, but believe it and push for a result for you. And that's where we're, I think, different than other places where you meet a medical practitioner, he writes a protocol, you go and sit down in a room with 10 or 20 other people rotating hourly, having IV, and then that's it. Go and do coffee enemas and juicing. No, it's not enough. And those people are turning over hundreds of people a month, and you know, some of those people, if they stayed at home, would have become cancer-free because the body can fight cancer. But you need more than that. Don't be in an illusion, because people coming from there and they don't have any muscle left. I had one young lad, a footballer, yes, couldn't even give him a B12 injection in his bum because there was no muscle left. Juicing non-stop for months is just not 100% good for all blood types. Some people manage with that, but other people, it doesn't agree with him. If you're losing muscle mass, it's not good. You need to do something different. Add some tuna into your diet. Add some fish. Lose your fear. If you have fear, you're never going to win. To win the gold medal, you need to put on the blinkers, you need to have a coach, and you need them on the same team. You need to agree to disagree or agree to agree. And one of the things that you need to agree to is, if you're doing juicing, only juicing, and you're losing weight, you need to start adding meat to your diet. I don't care what they say at the Gerson program, and I taught the Gerson program for 4 years. And I saw people dying so quickly because they lost all their muscle mass. And so I strongly recommend that if it's working for you and you've started and it's doing well after 21 days, continue. If it's not agreeing with you, add tuna, add some meat. If the difference in your making is between juice and a little bit of meat, I'm telling you, you're not going to make it. Now, 20 years, I've seen so many things, and the biggest stupid thing is people get so blinded. You can tell if something is not agreeing with you. Change. Don't wait until you have no muscle left to say, oh, maybe this wasn't a good idea. It's not a good idea. Okay, you're going to lose some weight when you started, and if it stabilizes, fine. But if you're still losing weight on the 3rd week and the 4th week, please understand, it's not working for you. You need to take a different tack. So we have people coming from Mexico, and I would say more than half of them we reject. You need to go home, get some weight on you, get stronger. You can't come here as a place just to die. If you make that mistake, you have to correct it yourself. We will fight for you. We will try, but make sure you don't leave it too long, that you need your core energy. People lose the core energy, it's too late. You need to have core energy, and that's why we have such a wide range of nutrition. Sure, eat food that is easy to digest, because 2 things, thinking and digestion, take up the most energy when you're sick and sitting in bed, or when you're only walking around the house. So that is why people say you have to stop stressing, because it's burning up all your energy. You're burning up your protein in your muscle because you're overthinking. You've heard of people curing themselves through meditation because their body is not using the energy here, it's using the energy to fight the problem. Meditation is great. Relaxation. Be in the same temperature every day of the week. Watch the ocean. It's so relaxing. But you need to get the mindset. You need to get the mindset that this is one of the processes you need. You need to find peace. You need to have calm. You need to not have arguments. You need to not have stress. You need to organize your friends. Listen, ring me between 5 and 6, Tuesday, Monday, Wednesday, and Friday. Because Tuesday, Thursday, Saturday, I'm meditating. I'm sitting on the beach. I don't want to hear from you. I need to be healing and concentrating about me. Brandon Beige, I don't know whether you read her book, amazing book. Documented by doctors, okay? She went into a meditation state, and the uniform that you put on and you fly around, that thing that was science fiction? When she wrote the book, that was science fiction. Now they're doing it. But she visualized herself going inside and floating through her body, going down into her stomach, penetrating the wall, down, finding the cancer and shooting it. And that was her process. And the doctor said they're checking her every day. You're going to die. You're going to die. Bang. Like it went. She said, give me one more chance. I believe I can get it. I'm missing it. I'm not managing. And she managed to cure herself completely, documented by doctors. Brandon Beige's book is available. You can still buy it, I'm sure. I've got a copy of that as well as 250 other books. I've read them all. And so the mind is so important. If you don't believe, you've lost the race. You've had children or no children. If they've been told they're a loser, they lose the race. You need to tell them they're a winner. You need to believe. You need your team to believe. Not look at you going, oh, she's going to die soon. No, there's no room for that. You're going to live. You can make it. We'll hold your hand. We will fight and push you. We will help you get the distance. We want the gold medal. You want the gold medal. We work together for that. And that's the strategy we have here at Atlantis Salute. And if you're thinking as a doctor to work for me, I want your blood, sweat, and tears. I only want you working a couple of days a week because I want you to work really hard. Harder than you've ever worked before. And that's Atlantis Health Retreat. That's our philosophy. So God bless you, my friends. Thank you for following us. Like and share the video. The only way we can tell other people or let them know about us, because we get so much problem promoting ourselves, is for you to share this video. Tell your friends. Series of 5. I've done 100 videos, but I'm doing one on each product this week. I don't do that very often. So share them. Who knows? They may be deleted. Share them before they go. Your friends need to know about this. Any health issue this video need to know about. It's not only for cancer. So God bless. Sleep well. Until we meet tomorrow. Bye for now. Just before I go, my friends, please like and subscribe. Share this video to your Facebook page and go to the Atlantis Health Retreat. You can see the link there at Atlantis Health Retreat. That is the Facebook page, and like and subscribe to that, because this is the page I'm uploading all of the new videos to. And if you didn't understand the link for the website, so there's the Facebook page, Atlantis Health Retreat, and you can go to videos and watch the series of videos here. Every week I try to upload more and answer the questions that I get each week. And this is the new website, and you can see here, you can click on there, and it goes to different cancer. There's a list of different types of cancer therapies, and so on. So please like and subscribe. At home programs, we have a lot of, I've only written up 4 pages for 4 different things, but we can help in a lot of things. But anyway, I just wanted to make sure you got this correct, okay? The Atlantis Health Retreat page there, so that you can find it correctly. It's a new website. Atlantis-salute-spa is the old website. And all of that information is still current, but this has been updated, this website. It's got a lot of new things on it, and I hope you like it. And please share this with your friends and post it to your Facebook page. The only way people can have a choice is to know that there are other choices available. So again, I really thank you for sharing, for liking, and please ask questions. There's no such thing as a silly question, and it's only through knowledge that you'll make an informative choice. So thank you again. Bye for now, and I hope you enjoy the next video coming up. Bye.